Good afternoon, everyone. Today we are discussing before we even go into that, I just wanted to let you know that we are trialing a different format. So with me, I have Hester van Aswegen. She's going to co-host with me. So what that means is that while I'm having a chat to you about what's happening in our stress, trauma, COVID, and our nervous system, if you have any questions or anything, she will come and tend to your questions, which you're going to put into the Q&A section, please. So if you have anything that you'd like to ask, then you will see a Q&A section that you can just type it in, and she will then pose those questions for me. So periodically I will stop and ask a few questions and answer them for you if I can, and we'll take it from there. So for those of you that don't know me, I'm Bettina Moser. So I'm a pelvic physiotherapist, and over the years I have had a interest in the workings of the mind and the body kind of more in an integrative way. So what has been, so I have subsequently done a master's life coaching certificate, and I am a tension and trauma release TRE provider. But I think what's been really interesting over the last few years is that the science of the integrative and more holistic approaches, the more mind-body approaches is starting to come out, and we have a lot of really great scientific literature to actually validate what is happening in our bodies, in our minds, how that fits in, how that works together. And so suddenly we're not discussing almost voodoo or alternative medicine or the other labels that mind body at times has, but we're actually starting to look at what this means for us scientifically and how everything starts to fit together. For those of you that don't know my colleague Hester van Aswegen, she is also a pelvic physiotherapist. She has been in the field for many, many more years than I have been. And I've been very grateful to have lectured with her over many years, and she has assisted me in my practice for the past, I forget, time flies, probably a good 10 years, and if not more. So many of you will know her, and she will assist us today, and in future will run some of these discussions as well. So welcome, and yeah, so let's get started. I'm going to just share my screen, and all right. So why this for me is interesting at this point in time is that we are dealing with a situation currently in this global pandemic that is putting us in a tricky situation when it comes to our kind of mind-body complex, and just the nature of the science and the workings of the body. It brings a very interesting dynamic into understanding our emotional as well as our physical reactions to what is happening in the world. And I think when I was looking at these various quotes, especially the one of Viktor Frankl, stood out for me, where for those of you that don't know, he was a Holocaust survivor, and his quote of "between the stimulus and response there is a space, and it's in that space that we have our power to choose our response, and in our response lies our growth and our freedom." And so this becomes interesting for me as we're looking at what is happening in the world currently, and I just felt that that's something that we could definitely start to apply, where we can really look at what is happening both emotionally, both physiologically, as in what is happening in the body, and really to empower ourselves to start to choose a healthier and more meaningful response to what we feel we cannot control. There's a gentleman called Thomas Hübl, and he was actually born in Austria, and he currently lives in Germany, and he studies and has a very kind of integrative way of looking at things, and his main interest is collective trauma. And he was saying that being able to respond to situations, in other words, not react. So react is a very primal thing, whereas a response is a higher cortical function. And when we are able to respond versus react, it allows and gives space for responsibility. So responsibility is really what comes from a response versus a reaction. So I'd like to just give a basic understanding of the nervous system. Unfortunately, it gets quite complicated, and it goes in many directions based on really what angle you're wanting to look at. And but I want to just give you an overview so that when we look at specifically how COVID comes into this picture, you have some foundation already in place and understanding of the nervous system. There is a professor of psychiatry called Stephen Porges, and he developed this, he calls it the polyvagal theory, but the long and the short of it is that he developed a way of looking at how the body reacts to its environment physiologically. And he described our responses to be one of three things. Okay, either there is social engagement, so that's a calm nervous system, so that falls into this kind of bottom green block. And because of the nature of his being a psychiatrist, he was looking at a lot into social behaviors and interaction, and he looked at how our physiology interacts with the world, and basically this calm or parasympathetic nervous system that allows for this social engagement almost opens up for certain connection. It's activated when you have feelings of safety, and that is when you can think clearly, you can learn, you can be creative, you are grounded. So those are the more emotional aspects. There is joy, there's presence. When it comes to the physiology in those spaces, what happens is that you are activating your vagus nerve. So you are opening up and allowing activity of things like your immunity, your balancing your hormonal systems, your body's, it's basically your cave. So it's where you can rest, relax, you can eat, you can digest your food. And for us, what has been very interesting working very much in the pelvis is that that's where our bladder balance sexual function is orientated. So when we are out of this nervous system, those areas of the body are not likely to be functioning too well. So when we move out of social engagement or out of the cave, our next primal aspect of the nervous system, so the nervous system is there to protect us, to keep us alive, to keep us safe. So really what's happening here is that we move into what we call our sympathetic nervous system. This is our fight and flight responses. And this is where we release a lot of adrenaline, release cortisol, and we have a variety of things that happen there. The blood is shunted away from the central organs into our muscle structures. We want to fight, we want to run, and various functions such as digestion or pelvic functions are not really the priority here. The sympathetic or the cortisol that is released creates inflammatory responses. So when we are in a lot of fight and flight and our nervous system is upregulated, what often happens is we have increased inflammatory mediators circulating in the system, and that our inflammatory mediators have a huge impact on a lot of our chronic conditions, and we'll look into that shortly. But once we move out of that fight and flight, and these again, they are primal, so it's not stuff that you think about. The nervous system does it to keep us safe. So when we are feeling that we can fight, or we can't fight anymore, we can't run anymore, our body moves into a space of freeze. So in the animal kingdom, the way that would look is if a cat has to catch a mouse, initially that mouse would run, its nervous system would realize that fighting is not an option, so it would generally activate a flight response. And if it's caught by that mouse, what happens is, caught by the cat, the mouse will almost play dead, and that's a freeze response. So it's an immobility response, and that is again to keep us safe. And basically, it's there to get us through that trauma experience. So if we're going into a car accident, we would first initiate a fight and flight response. We would, our senses would be upregulated, and when the nervous system anticipates that it cannot move into, cannot avoid this accident, it will move into a state of freeze. So what happens there is there will be like a dissociation, and that's why a lot of people will often describe themselves as viewing the situation, the trauma situation. They will be shut down. There'll be a strong release of endorphins to cope with pain, and really it's almost a energy conservation space to get us through the space. So in trauma, these are wonderful kind of strategies for the body to employ, and that's what it's designed for. It's designed for survival, but it's not necessarily designed to thrive. So if we are in high stress, so not only physical trauma, but also emotional experiences can push us into various nervous system states. So if we feeling that we are in a space where we feel very helpless or hopeless, or feel we have no way out of a situation, our body may move into states of freeze. And if it's been there before, it is kind of a go-to for the body. So most of us, because most of us have been raised in a world of trauma, we don't have a very loving and balanced world that we have been raised in. So most of us have some trauma, be it a huge degree of trauma or minor trauma, but generally our nervous system will move through different states to cope. But ideally, one wants to come back into the social engagement, this relaxed nervous system, where our immune system can build itself up, where we release oxytocin, which is a bonding hormone. We can connect. We can have quality of life. So, and ideally, the relationship between these states is that you ideally want to be spending 80% of your time in calmness in your parasympathetic nervous system, and possibly about 20% in these fight and flight responses. So if we have to look at the calm nervous system specifically, the vagus nerve is primarily responsible for our what they call vagal tone, or your calm aspects of the nervous system. And if you have a look here, what you can see here is just, when you look at the parasympathetic nervous system, how many kind of organs and areas of the body that function in the calm nervous system. So when we look at the eyes, the salivary glands, like you will notice that when you're stressed, when there is a lot of adrenaline, your mouth becomes dry. It affects your heart rate. It affects your lungs, your capacity to breathe deeply, to exchange oxygen well. You're looking at your gut function, so all your liver, gallbladder, stomach, spleen, pancreas, and all your kind of digestive enzymes are acutely hinged into your calm nervous system. So the minute you are out of sync, or your nervous system is dysregulated, the first thing that a lot of people complain about is actually their gut function. They feel bloated, they feel uncomfortable, this area doesn't work very well. Our calm nervous system also is involved in peristalsis and assimilation breakdown and the whole process that happens in your gut. And then when you go further down, you're starting to look at what happens in your kidneys, in your bladder, in our sexual organs. it's in charge of all the endocrine functions. So when you're looking at the thyroid, the adrenal glands, the pituitary glands, the testosterones, the fertility hormones. So really, you are hinging your entire system's functioning on your, or the well-being of that, into this parasympathetic system. And clearly one can see that if we are not balanced in that, then just physiologically in the body, you're likely to have a whole kind of series of potential disease or ill health coming from that. So really, when we look at the more science of it, you know, the field that's arising now is what they call psychoneuroimmunology. So this is really merging the psychology, looking at what is happening at the level of the mind and our interactions with the world and ourselves and our well-being from a psychology component, psychological aspect. And then the neuroimmunology, the neurology of how it all fits together and how that affects the body, how it affects the immune system, how it interrelates with various, systems, illnesses, chronic illnesses. So if we're looking at the nervous system, a lot of our anxieties and depressions and post-traumatic stresses and Parkinson's have attributed to a dysregulated nervous system. So there are many words we can use. I tend to favor a dysregulated nervous system because it kind of is all-encompassing for me. But when your nervous system is dysregulated, what really starts to happen is that you start to release a range of neurotransmitters from the brain that have a cascading effect on the body. So we will release like I said, the cortisol, which is responsible for a lot of the elevated inflammatory markers. So our inflammation increases, and they found that will specifically cause a lot of our chronic. They've linked it to. They've linked depression to inflammation. They've linked depression, inflammation to anxiety, to diabetes, so all of these chronic conditions, heart conditions, cancers, our autoimmune, our gut dysfunction. So all of that stuff actually starts to hinge into nervous system dysregulation. And really, when we start to look at how do we resolve these problems, where does one begin when you are looking at such an extensive and interlinking system that's at play? And I think what's happened over the years is that we are focused specifically on possibly the local system and not really understood the interactions with the more central nervous system. And I attribute it to almost like a fish in water. You know, if you've got a freshwater fish and you're putting it into salt water, it's not going to thrive. So you can pay a lot of attention to really kind of getting the fish right. But if it's not in the right waters, you're not going to thrive. So when we look at this whole system, really the immune system is affected, our endocrine system is affected. That, you know, if for anyone who has thyroid problems or has a burnout, which is more the adrenals, you'll know that the whole system again gets affected by that. And not only are we affecting that from the top down, but also from the bottom up. So what's happening is this dysregulation that we have can be triggered either by our more psychological elements. So when we are feeling depressed, or when we are feeling anxious, or we bombarded with a lot of fear in our environment, or adverse situations on the outside that cause a emotional disturbance, we will have a certain release of neurotransmitters into the system. And that, so if you suffer from pain, for instance, if you are anxious, or if you are feeling some depression, your inflammatory markers will by default be up, and you will flood more of that. So it becomes this ongoing, so the pain will get worse. And so we have this almost relationship that develops and it's an up and down. So not only are we experiencing what's happening from the top down, but we're also experiencing in our minds what is happening from the bottom up. So when the body is sore, when the body is has a lot of toxins in it, when it has a caffeine and stimulants, and the endocrine system is not functioning well, naturally you'll have a cascade coming back up that feeds that. So it becomes this almost interactive model that one starts to ask themselves, how do you resolve a lot of either our emotional or our physical symptoms? And what will normally happen is that someone will come in with a specific kind of entry point. And you'll normally notice that there will be a whole like basket of eggs in a way. And I think where I love the understanding of the nervous system is that usually you can start to really see how all of these eggs in the basket start to interplay and interlink. And if we can almost get the right type of intervention coming in, you actually resolve many more aspects than the one that might be the main complaint. So then one goes to really, how does this nervous system get dysregulated? So what happens there, and really this is a vast topic in and of itself, but they have attributed this. So if we had to go back to what is nervous system dysregulation, so ideally your nervous system should be able to move up and down that graph in an easy way. So we need a stress response. We need to be able to fight and run if we are threatened. We need to be able to freeze if the threat is large. It helps protect us. But what needs to happen is we need to be able to come back down into a regulated state. And that is frequently what is not happening. So the system will move up into a space of fight and flight or freeze, and suddenly get locked in there, and it doesn't know how to come back down, and this almost over an extended period of time can almost hook that experience into, it's almost like a roller coaster, and as it goes up the loop it gets stuck there and it can't unhook and carry on the loop. So the fact that we move through these different states, that's perfectly normal, but where our problem comes in is that if we are almost visiting those spaces too frequently for a well-balanced system, that can be a problem. Or if we get stuck in a certain state, like with post-traumatic stress, you almost can't come down and relax. So what they found is adverse childhood events or environments can almost, even as far back as in utero or in a birth trauma. So where the baby's nervous system gets almost regulated or dysregulated by the mother, and doesn't have the environment in which it can understand what regulation is. So in our children, when they get dysregulated and move through those different responses, as the adult or the caregiver, or there needs to be a regulated nervous system in the room for that child to tag onto, because regulation comes in safety. So when we are unsafe, we dysregulate. So anything that causes lack of safety, so things like developmental trauma. So sometimes what happens is as we grow up, we don't necessarily have specific events that we can attribute our kind of nervous system responses to. But what might happen is that we might be in an environment that's stressful, or possibly our parents were under a lot of stress, and over many years there is a kind of normalization of stress in the child, and it becomes difficult then for that child coming into adulthood to understand what normal is, or what a well-regulated nervous system looks like. Then obvious things are things like trauma, illness, hospitalization, surgeries. Those can dysregulate the system. toxins. So we live in a very toxic environment. Our food systems have a lot of kind of chemicals, our water, our foods. So there are a lot of toxins that are around, and there is some discussion and research around that being a cause of a lot of different both psychological and physiological problems. But the toxins actually cause nervous system dysregulation. It's almost like the body's in constant fight and flight, but internally. So there's nothing actually happening on the outside necessarily. So we can create those nervous system responses by the nature of our internal system as much as externally. Things like food, which would be another internal kind of dysregulator. We have a lot of refined sugars, carbs, stimulants, caffeines, MSGs, those types of things. And what happens is that you know, for instance, the refined sugars and carbs actually cause inflammation. So if you are already in a stressed state and you then, which is natural, what do we go to when we're stressed? We go to the sugars, we go to the carbs, and they actually cause more inflammation. So it's an interesting dynamic of what happens in those spaces. Right, so I'm just going to stop there for a seckie. And let's just see if there are any questions or anything that we want to discuss around the nervous system before I carry on. So Hester, I don't know if there are any questions. If you have questions, just pop them into the Q&A.
I think an interesting point that one really finds is that people with chronic pain and many chronic conditions really battle to manage their stress levels well. And I think that graph that you showed us on the fight and flight and then the freeze system becomes so important for people to understand, because they really do not realize the impact that the stress hormones and the cortisol have on their bodies in many different ways. And what you were saying about how that increases your inflammatory response and then actually just leads to almost an aggravation of many of those chronic conditions. And I really feel that that's such an important point for people to understand.
You know, the thing with it is, and it goes back to kind of many discussions that we've had over time of like, you know, why are things not adding up? And I think this is the reason why it doesn't add up, because as much as we are trying to deal with chronic pain and the almost long-term effects of long-standing inflammation, you know, and then when we rub and when we do our hands-on work, what are we doing? We're causing another inflammatory response in an attempt to control the inflammatory response. And really it's about balance. But you know, and when you are in pain, what happens naturally is you have an emotional reaction. And when you have the emotional reaction, you flood the system with more, and it becomes this feedback loop that becomes a tricky and interesting dynamic, because when you look at just the inflammatory stuff, it means that there is value in what people eat. And discussing that and helping people understand that. And there is value, and a lot of people will say, but you know, my anxiety or my depression or bipolar or whatever, Parkinson's or whatever's coming up from that is not the problem. You know, I've got a body pain, it's not in my head. And this is where our medical models have separated what is happening in our so-called head, which needs to be managed at the psychologist or the psychiatrist, and what is happening in our body. And even something like pain, you know, or is a big discussion when it comes to, and I think maybe what we can do going forward is actually do a whole webinar on kind of pain and inflammation. But yeah, and what is actually very interesting, and I'll discuss it, is actually where COVID fits into that, because it's directly linked to how our system reacts when it meets the virus. So yeah,
Absolutely.
that's very exciting. Okay, if there's nothing else, then I'm going to carry on. So let's go back to looking at this kind of COVID situation that we're exposed to currently and what that means in the context of our nervous system. So really what we need at this time is a good immune system, and we need resiliency. And what we mean, and resiliency is really being able to ride waves. It's being able to allow external forces and situations and circumstances to bounce off us in a way that doesn't destabilize us, that doesn't deplete us, that allows us to basically function optimally, and that is both physically and emotionally. So in our current times, we have a great need for physical resiliency by the nature of the fact that we have a pathogen in the mix, and we also have a great need for emotional resiliency because we're living in a very stressful situation by the nature of what is happening in the world. And when we look at resiliency, the research shows us that the term resiliency is a reflection of our nervous system. A nervous system that can regulate well, that can interpret its environment in a way that it can respond versus react, means that it can have kind of more optimal choices of response versus that knee-jerk of a reaction. And looking at our immune system, if our nervous system is not regulated, by default our immune system is affected, which is not an ideal situation in this, yet everything is leaning towards our nervous systems being dysregulated at a time like this. So really, when we look at what is this pandemic or this situation, and I say I'm referring to kind of the circumstances more than the virus, because we cannot look at it in isolation, because by the nature of what is happening, we're not only dealing with a physical threat, we're dealing with emotional threats, we're dealing with economic changes, we're dealing with a variety of deep triggers. And really what the situation is doing is it's providing a very strong physical and emotional experience, okay? And that hinges strongly on our current nervous system state. So there is kind of a lot of stuff coming out now and some papers coming out and what they've noticed is that people who have prior trauma, those that have been under stress for long periods of time, have had, so all those factors of a dysregulated nervous system are finding it a lot more difficult to withstand and cope with both the physical and the emotional experiences of this kind of current time. The thing with that makes this very interesting is that they have attributed the deaths and more severe COVID responses to the inflammation in the system. So when the virus meets the body, it causes like an inflammatory reaction. And the thing with that is that if your system already has a strong inflammatory response by the nature of all those other things, what happens is it blows up and it can't cope. On top of the fact that our immunity is weaker in those situations. And what happens is a lot of the high risk illnesses and the comorbidities almost that go with that are related to inflammation from the start. So your diabetes, your heart disease, your lung conditions, a lot of those are, and your immunocompromised, a lot of that is already because of an inflammatory link in the system. So the kind of debates that are going on is that, is the diabetes the problem, or is the dysregulated nervous system the problem? And that is on the physical capacity. When we look at the emotional capacity, our anxieties and our depressions and our emotional destabilization also comes from that same nervous system. So, and what is happening, we are getting stressed out. So the stress weakens our immunity. It's just this ongoing kind of chicken and egg story. And what do? We go to, well, the Western diet isn't a very optimal diet for the nervous system and with regards to our processed foods, our toxins in the system. So that again goes back to our immunity and our inflammatory markers. So we're kind of leaning towards a situation where we can't control, we're not going to control what's happening in the outside world in that regard, but what we can control is what's happening within our inner world. And we can see that with the nervous system that is dysregulated, we are more likely to have less than optimal kind of circumstances arising as we are either faced with the virus or the meeting of the virus, or just meeting of world events and stress and fear and social distancing and all that goes with it. So, on top of that, like I just said, there is stress, there is fear. It's compounded by prior stress. A system that has a lot of stress and has experienced trauma, childhood traumas, various traumas through their life is less adaptive, it's less resilient. It cannot bounce back as easily. It cannot push back or be less reactive. It is very reactive and it's not as responsive. What happens is that because of our current situation, our nervous system moves into a space of shutdown. So, when you're looking at, for instance, a lockdown situation, you can't run. Well, you can try. You can't fight. So what happens is that where must the system go? So the nervous system goes, well, I can't fight, I can't run, there's nothing I can do. It's almost like the cat has got me in its jaw. What am I going to do? So I'm going to freeze. I'm going to shut down. That is the nervous system coping mechanism. And in doing that, it almost goes into a bit of a hibernation state in an attempt to preserve, stay alive, and get through it. The free state is a very it's designed for trauma. It's designed for short bouts of trauma. It's designed for that car accident. It's designed for the hijacking and the rape. It's not designed to do this for months and months and months. So what is happening now is I'm starting to see the effects of the nervous system almost reactions. So, people are just not coping either physically. The body is the areas that require calm and the parasympathetic nervous system, those areas are playing up. Our gut problems are playing up, our constipations, our sexual functions, our libidos, our endocrine glands, our the bladders, all of our muscle tensions, our pain, together with what is happening emotionally, the depressions and the anxieties. And again, that feeds it. So we're constantly going round and round and round, okay? And it becomes a almost scary snowball effect that and I think this is what, if there's anything that I want to convey in this kind of discussion, is that we really cannot control what's happening outside beyond a certain point, but we can. And I guess what I'd like, to get across is that we can, and there is value in starting to look at what's happening internally, to look at our internal circumstances, our internal environment, what we eat, how we kind of choose to engage in the world, how that affects our nervous system, what the effects of all of that has, you know, and because that is where our empowerment lies, that is where our responsibility lies, and that is where our resilience lies, that is where we can start to actually feel that we can have a certain aspect of power internally. The other thing that you know, this that COVID has brought about are the wearing of masks. So there is a lot of mask debate. That's not what I'm here to discuss, but you know, there are questions around whether it's effective or not, and whether that does anything. There is discussion around the breathing in of carbon dioxide on an ongoing basis, and how that affects your lung function. And really, COVID it affects the lung function. So if you are potentially affecting your lung function with one of the kind of implementation or protection implementations, it becomes a tricky discussion. But what masks also do, and this is kind of the work of Stephen Porges, that's the psychiatrist, is that masks break connection. So what they found, and there's another man called what's his name, David Perlmutter, I think is how you pronounce it, and he's a neurologist, and he was looking at kind of our aspects of connection, and masks come into that. And they were saying that what happens in the nervous system is that so in a threatened state, the so let's put it this way: in our parasympathetic, our calm nervous system, in the vagal nerve, there is a lot of facial expression, and we connect in facial expression. We smile, we soften our facial features, we make eye contact, our voice changes. So like when you're talking to a baby, it's more like there's more of a melody to it. Our hearing changes, and really there's this whole kind of physiological engagement that happens when we meet each other, that is beyond kind of the cognitive frontal cortex, you know, thinking brain. We don't think about these things. We naturally engage in a specific way, and when it comes specifically to babies and children, they are out of the language aspects. They work on what we call neuroception, which is the feeling kind of aspects. So what happens is our nervous systems communicate with each other, and one of the ways that we strongly communicate is in our facial features. And you'll naturally notice that when you see a baby, you'll smile, you'll soften your facial features, your voice changes, and now suddenly when you're wearing a mask, there is almost this like complete like disconnect that happens there. And the nature of your physiology and your neuroceptive aspects, which is beyond higher thinking, naturally there is a threat in the nervous system. So when we have these you know, specific kind of blank looks, or we lose eye contact and connection, we naturally saying to the system, I'm unsafe. And if you're unsafe, what happens is that you will naturally move into a fight and flight response, or into a freeze response, depending on to what degree your system is perceiving the lack of safety. So it's just an interesting dynamic when we look at how our nervous system actually interprets these types of safety measures. Okay. Then when we look at the aspect of social distancing and the almost disconnection that arises in that. So this neurologist put out a paper earlier in the year, and he was discussing how he was discussing specifically the area of the brain where we which is called the amygdala. So the amygdala gets activated in stress responses, and our prefrontal cortex is where we can rationalize and interpret our surroundings and allow for responses versus reactions. Amygdala reacts. So what they found is that when we are in disconnection, we are actually, in the nature of the disconnect, we are in a trauma response. So if you disconnect a baby from their mother, or children from the safe space, they will have a trauma response. So disconnection and social distancing, by the nature of it, is unsafe, because what do when our children fall? We pick them up, we hold them, we rub, we touch, we tell them it's okay, we engage, we connect with them, and suddenly we're not allowed to connect, we're not allowed to touch, we're not allowed to hold. And the nervous system, in its very primal ways, interprets that as unsafe, as threatening. So what happens in that is that we release and we activate our stress responses, and we get that whole cascade happening in our neurophysiology that I discussed earlier. So, you know, we're almost as if we're in a catch-22 position with kind of how we're meant to keep ourselves safe in with regards to pathogens. And then on the flip side of it, that almost aspect of keeping ourselves safe is actually not making us feel safe. So there's almost that paradox happening there that is interesting. We also have economic and lifestyle changes. So, you know, we're working differently. If we are working, you know, there have been a lot of kind of economic changes. We have children at home. The way that we understood our lives and the way that we were used to living has changed, and that in and of itself brings about a stress response and an adaptive capacity, a need for an adaptive capacity. And again, that is an aspect of resiliency. The ability for us to adapt to situations is a nervous system response. And it comes from regulation. A regulated nervous system can adapt, can respond, can modify, can change, and can cope with that in a far easier way than a dysregulated nervous system. So really, if we're looking at that Thomas Hübel's work and around collective trauma, we are sitting in a collective stress and trauma currently, and that becomes an interesting discussion in and of itself, because suddenly we're looking at what is normal versus what is natural. So our current COVID lifestyle and circumstances is our normal, but it's very, very far from natural. And what happens is that we start to normalize things, and they become almost our natural, but they're very far removed from natural. And because almost the whole world's doing it, then, you know, it kind of becomes a collective trauma response. And what happens is that so what they found when they did work with kind of war or the Holocaust or things like that, where there was collective trauma, that collective trauma was almost normalized in the system. And it wasn't, so when you emotionally or physically presented a kind of stress response, let's say, it was perceived as normal and not actually taken and paid much attention to. And in that, it almost just continued because that's just kind of normal. So, but what happens is if that becomes our normal and it's so removed from how naturally our bodies are designed to work, we potentially, if the circumstances are such that they are prolonged, we could be in a situation where we have very less than optimal psychological and physiological responses meeting us in the future. And we've already can see that. We can see the suicide rates going up. We can see the domestic violence. We can see the rape rates. We can see kind of all of that, because people are just not coping. The depression, and the body will follow. And if the body is already struggling with certain things, that's going to get compounded. So I think what is important, and again it comes back to a space of self-empowerment, is just really understanding, and there's, again, not beyond a certain point, there's not much that we can do about what's happening out there, but there is, if you understand the interplay of the nervous system, where possible, you can allow the nervous system to engage in a more natural way that is still safe in our current kind of paradigm. And what is important here is that our nervous system responses are ones of neuroception. So we tag on to our, we don't only interpret our environment through kind of verbal engagement or touch or whatever. There is a almost like a nervous system tagging on, and you can see that in the wild. So let's say a herd of elephants is kind of at the waterhole. The minute the elders of the herd's nervous system responds and brings up a stress response, by the nature of neuroception, what will happen is that the young in the herd will perk up, because if they don't, they won't survive. So it's a primal survival mechanism that's built in. It's designed to be there. So when we are constantly surrounded by a stress response, because the whole world is in a stress response, we are constantly, by the nature of this neuroceptive capacity in our nervous system, becoming upregulated. And this is where we may want to look at strategies to actually be aware of that and to manage that. And also co-regulation. So what happens is that when our nervous systems become almost dysregulated and go off kilter, we have a system of co-regulation where in the wild, the animal goes back to its herd, and it's a safe place, and the almost kind of nervous system, or the safety of the herd co-regulates that one animal. So in our children, they feel safe by the nature of when they kind of fall or something, it's the parent or the caregiver that almost holds that space of co-regulation for that the nervous system of that child to come back into sync. So the question is, in situations like what we're dealing with now, how are we co-regulating? Because who is holding the calm nervous system that says you are safe to come back into relaxation? And everything from our news to everything, every shop you walk into, you're spraying, this all stimulates a stress response. And yet we are designed to co-regulate. So if we don't have places where we can come back to where we are safe, and this is a space of connection to other, it's not in isolation. Trauma is in isolation. The trauma models are about separation. The healing models are about co-regulation and connection, and they found that when individuals are disconnected or where they've removed touch and all of those aspects of connection, their health and well-being decreases. So they have attributed, various cancers, diabetes, Parkinson's, Alzheimer's to isolation. So when we are isolated and lonely and alone, we don't as a species cope very well. So these are things that become an interesting discussion in what we are faced with. And it brings us back to this earlier slide of between the stimulus and the response, that there is a space. And if we can realize that if we can create that space and be mindful of that space and regulate the nervous system, that we can see that space, it's in that space that we then have the power to choose our response. And even if that response has got nothing to do with the external world, but it's an internal response, we then kind of have the opportunity for growth and freedom and well-being, and this is the space where we get out of reacting into responding, and we can start to take responsibility. And even if that is for our own health and well-being and those around us, and it goes into all models of work and all of that, which we can look at. But I'm going to stop there for a second, and Hester, I'm going to come back to you and just touch base and see if we have any questions or comments. Or
I think a remark was made about how interesting it is that the masks that we are now wearing actually breaks the connection, and one doesn't always realize that we are really not able to see one another's faces and our expressions of emotions. And I think you highlighted that really well.
And for me, that's interesting, because when we're in a space of healing and well-being, and and it's something that I take to heart and consider as my role, and the roles that you and I play, is that how do I make my patient or client feel safe? Because only in safety can their nervous system relax. Only in safety can they have optimal opportunity to heal, to relax those tight muscles, to get out of their chronic pain cycle, to resolve their kind of gut issues and all the cascading things. Because if they, and when you already have a problem and you've got to come and see someone like us as a pelvic physio, for instance, that is already threatening in and of itself, to discuss these very intricate things. But when you are then still having all these barriers of connection, it becomes interesting. And that's where, even when I go out, or when I kind of, even if it's a petrol attendant, I make a point of making at least eye contact. So like part of our vagal expressions is in the eyes, and our eyes soften when we connect, when we engage, when we relate. And there is a lot of kind of expression that comes into our eye contact, and this is where, when we understand that, I'm not saying you must or mustn't wear a mask, but I'm saying to you that understand that when you're wearing a mask and when you're engaging with people wearing masks, there is a threat response by the nature of and just, and little things like just, talking to them and connecting in eye contact. Not only does it regulate your own nervous system, because you are almost regulating your own to engage, but you're also regulating the person on the other side of that. So it's very, very fascinating.
No, so true.
Right, anything else, or should I carry on?
I think let's carry on. There was not another
Okay.
question.
So, oh, sorry. There we go. Okay, so now we look at, so how do we go about regulating our nervous system? And so one of the that neurologist, that David Perlmutter, was saying that, and I find this very interesting, because he was saying that one night of bad or poor sleep can actually increase your amygdala, which is your area of the brain that kind of gets excited and hyper, aroused with a stress response. one night of poor sleep will activate that area of the brain by an increase of 60%. So that, and when that area is activated, the nature of our prefrontal cortex, our decision-making brain, our rationalizing brain, our, when we engage that aspect, that almost calms that amygdala down. And so there is a almost disruption of that, and one can see one's irritability, one's moods, one's go to foods and coffees and stimulants and crisps or whatever when we've had a bad night's sleep. So it's quite interesting to see how almost it all starts fitting together. But when we want to start to calm the system down, sleep and is a very critical thing. And I think what's happening in kind of just our modern societies, I think in times gone by, we would sleep when the sun set and rose when it's sunrise. And our current kind of sleep habits can be very poor. We have a lot of screen time, night screen time. We've got a lot of devices. We've got a lot of Wi-Fi. We've got a lot of kind of things dysregulating our nervous system and our sleep patterns, and we may watch the news or CNN before you go to sleep, and it's that type of stuff. And it's not only about your hours of sleep, but it's also about your quality of sleep. So sleep is something that they really start to look at nurturing when we want to look at the nervous system, and it's about getting sleep routines. It's about taking the time to come into healthier sleep patterns, to have that bath, to meditate, to calm the system down, to start removing devices, the lighting, the screen time, and before sleep to decrease the stimulants. So then it goes to looking at the foods before we sleep, and really just a whole relationship with sleep, and that whole kind of experience of rebalancing in sleep and coming down. And really, when we look at the percentage of time that we sleep in our 24 hours, we see that it is a large percentage of time. So it becomes one of the critical kind of balances, versus if we look at meditation, we may meditate for 5-10 minutes, half an hour, but we would sleep for 8, 9, 6 hours of the day, so it becomes a critical point when we're looking at that. The next thing is looking at rest and rejuvenation. So actually taking the time to listen to the body. And when you're aware of these things, if you start to understand the kind of nature of the beast and looking at how am I going to stay on my surfboard, how am I going to ride these waves, we're going to ride these waves by actually taking care of ourselves and seeing the value of taking care of ourselves. And one of the beneficial things I think that our lockdown and COVID has done for us is it's made us go back to basics, and it's allowed us to have more flexibility in various aspects. And, we possibly are not as office bound. We might be working more from home. Yes, it brings other challenges, but it is important to kind of start to take care of oneself in a different way. We can look at how our diets in that regard, fluids, being mindful of the inflammatory components within food, the toxins, because all of that is going to compromise the system. And really, when you are going out and possibly meeting COVID, your system, you'd much rather have it fight the virus than fight kind of the toxins or all the other stuff that's happening in the system. So the way we can also look at regulating the nervous system is through breathing exercises. So breathing is a really powerful modality that is really underestimated. So when we breathe well, not only are we expanding our lung capacity, but we don't use a lot of our lungs, especially the lower lobes, and it can get very stale. The air is stale. You're likely to, if there are any bugs down below, you're less likely to clear them because you're not getting as much oxygen. So just some breathing exercises, some deep breathing, some sighing. But what breathing also does is it starts to move the diaphragm, it activates the vagus nerve. So when that vagus nerve and the parasympathetic nervous system starts to kick in, suddenly the brain says, oh, I'm safe, I'm okay, we can relax a little bit, we don't have to pump out so much adrenaline and cortisol, we can start to digest the food, we can work on our immunity. So even just a simple thing like breathing can, and that's why we use breathing for pain, because it switches everything around and we start to decrease inflammatory markers. But it's a really simple exercise that has profound effects. And again, when you look at what is happening in the world, why are we not taking on something as simple as a breathing exercise a couple of times a day, or even just sighing when you notice the tension, or you just sigh it out a few times, and slow down, take a breath. So meditation is another thing that they've done quite a lot of research on, and they've found that in a very, very short period of time, like depending on your almost ability to tap into meditation. There is an art form to meditation, but being able to, and meditation is not a specific way of meditating, it's just being able to quieten the mind, come into the body, relax, mindfulness, that type of thing. Immediately what's happening is they when they're doing the brain scans, they can see different areas light up. So those areas that light up with stress responses actually come down, and other areas, your creative centers, your healing centers, your engagement centers, all of that starts to light up in the brain. So it has a profound effect when you're looking at your neurophysiology. And in meditation, when I use the word meditation, I use the umbrella of kind of mind training, prayer. It's not a specific kind of Eastern traditional meditative practice. We can use, so when we regulate our nervous system, we can use strategies that we call top-down strategies, so mind strategies versus body strategies. So the meditation would be a mind strategy. Things like yoga, martial arts, and exercise is a body. So when the body feels better, that feedback up into your psychology and your nervous system changes. They found things like singing or humming or chanting activates your vagus nerve, which is quite interesting. So that's why we sing to our children and we lullaby them to sleep, and we hum, and that actually really just changes that whole nervous system response in the body. And yeah, they can be easy strategies. They don't have to be complicated, but they can be really effective in the long term when you look at what's happening. So creativity also calms the body-mind complex. So, that can be anything from, if you are an artist, or if you enjoy painting or pottery or knitting or sewing or woodwork or gardening, or, all of that, it just almost, it activates different centers in the brain, and it brings about relaxation, and in that relaxation we release different neurotransmitters. So there is a lot of healing. The more alternative healing approaches are done through creativity, where they're actually bringing in creativity and music and humming and chanting and dance and all of that into our into the healing space. And what they're really doing is they're creating nervous system regulation. So they're giving the body the opportunity to internally do its own healing. What they've also found is that so if you go behind your earlobe onto kind of there's a bone there called the masseter bone. So what happens is that you can stimulate the vagus nerve by just massaging behind that gently. So when you think about if you're kind of feeling very stressed out, or kind of before you go to sleep, just really massaging, sighing a few times, breathing, maybe listening to some music, and just having a few minutes of that almost very intentional and mindful nervous system down regulation. It works wonders. But remember that most of us have been in this hyper alert state for so long that it's not like you're going to massage for 30 seconds and you're going to, like feel like, all your stresses run away. But it does definitely give that opportunity to switch over and switch over and switch over. And if you remember us saying that we ideally should be 80% in our calm nervous system and 20% in our stress responses. And that I know very few people who I can say live their life like that. But if we can constantly switch the system, switch the system, switch the system with a variety of different things, we almost give our body just that opportunity to almost catch a breath, release it, have a different neural pathway that it can then hopefully tag onto in the long term. As we discuss things like laughter, connection, eye contact. So really, I think what is important for us at this time is to take advantage of our capacities where we can connect and how we can connect, and what that connection looks like. So if we are not able, or there is fear around like physical and body connection, we can connect in these types of platforms. We can, it's about connection. It's about, we are not designed to be in isolation. We are not designed to withdraw. And a lot of what has happened is that trauma response has caused withdrawal by the nature of it. And that's a reaction. But if you can understand what that withdrawal actually, the effect of that and that disconnection has on your emotional and physical well-being, you can start to respond in a different way and take the opportunity to connect with your family, with friends, in ways that feels good for you, safe for you. The other thing is grounding and being in nature. So because we are intrinsically, we co-regulate, and we kind of have that neuroceptive capacity to tag onto different nervous systems, they have found that being in nature will actually activate our parasympathetic nervous system. They've even found, which I found amazing, I'd never heard of that, but even just looking at a picture of a nature scene actually in the brain already changed the neurophysiology. So it's almost like our system is designed to understand our interconnectedness with both each other and our world and nature, and just almost allowing ourselves to connect back into that already changes and creates a state of perceived safety and nervous system relaxation. So and that we're fortunate that we have beautiful weather, and we have gardens a lot of the time, and we are able to get outdoors a lot easier than kind of currently our northern hemisphere friends and colleagues. So what's happening is that when we understand that, we really can understand the value of, on a daily basis, going into nature, getting outside, letting the kids run around outside with no shoes, take your shoes off, just swimming and connecting with our more natural environments that our body understands and primarily feels can co-regulate with it. So the other thing is things like talk therapy or journaling, so there is value in actually not harboring all this our stress responses and our kind of emotional cascading and belief systems that get triggered, and you know, our emotions that are triggered in this space. There is value in moving that through your system in a space where you can talk about it. You can, you know, if you do have a therapist or somebody that you have a relationship with in that capacity, but even something like journaling, they found a massive kind of, again, journaling is used in healing, and I use healing as a broad term because when you regulate the nervous system, you know, even in kind of cancer work and things like that, but you know, journaling is one of the key players when they're looking at more holistic healing, because again, it calms the nervous system down, and when the nervous system is calmer, you're not secreting as many um, inflammatory mediators. Your cell replication and the way that your cells replicate changes. So for instance, in cancer, what happens is that the breakdown and buildup is not in equilibrium. And, you know, so it's all of these things that when the system can just come down and settle, the body knows how to heal itself. We were designed like that. We wouldn't be alive anymore. So it's about accessing all of that and understanding the value of accessing that, especially in our current times. And then there are a lot of supportive therapies. So I do TRE, which is tension and trauma release, which is specifically a nervous system regulator, mind body kind of very natural and primitive type of access of the body's regulatory systems, if we can put it that way. Things like kinesiology, craniosacral therapy, various fascial modalities. I know Hester does some of that, and maybe Hester, you can elaborate on your experiences with that. So, you know, we create a lot of tension in those areas, massage, touch, connection. You know, all of that becomes very, very therapeutic, and I really feel that we need to start kind of accessing those internal responses, and we need to take responsibility for what is happening, because you know, our well-being and our survival and thrival is hinged on it. So the result of all of a nervous system regulation is that it becomes more adaptive. Okay, it becomes more resilient, both physically and emotionally. It can cope with stresses. It can be under stress and it can bounce back again. It improves your immunity, and even if you have to move into a space of ill health, your recovery is much better. It allows for creativity, it allows for innovation, for intuition, and these become critical components in our current time. So our economic and our working models need change, our school models need change. That change cannot come from a space of freeze where we are shut down, because those models that are needed, or kind of work structures that are required, that we need creativity, we need innovation, we need resiliency, we need those almost higher cortical functions to come in. We don't need our primal survival strategies to be driving that, because those primal survival strategies will say, go inside, lock the doors, never come out again. You know, it's anything just to keep safe. And yes, we need to keep safe, but we need to also thrive. And those are higher cortical functions. And so, you know, in regulating that, we access our creativity, we access innovation, intuition, our gut feelings, and overall we have an improved well-being, both in all capacities. And that is the way that we can almost look at thriving, even in very challenging circumstances where we feel that we don't have too many options available to us. So thank you for that. I'm happy again to take any questions, and if you are not on my mailing list and you are interested in further talks or discussions, I run them regularly. I also have various things that I do. I run an online TRE group, and I have various kind of programs that will be starting in the new year. But if you are kind of not on our mailing list and you are interested, then just drop onto my website and you can just subscribe to the newsletter. If you have any other questions or anything that you'd like to address to me, there's my email address, bettina@bettinamoser.co.za. But otherwise, I'm going to stop there and we can see if there's anything else that we want to chat about.
Bettina, thank you. I think that was a most informative talk and so important in the times that we're living in at the moment, where people really are feeling such a lot of stress. And I think what is also nice is the fact that you've highlighted that there's simple measures that we can use every day. Simple things like breathing, a little bit of meditation, the massage behind the earlobe. It's things that everybody can do, and it really can help down regulate our nervous systems. And that is so important. So it's not something difficult that people have to go somewhere to do. They can actually do that at home. And if they can really start applying these really simple measures, it can already make a big, big difference to their systems, to their immune systems, to their health overall. And I think that's really an important message that one would like to give to people out there.
I think what's also important is that they don't cost money.
Exactly,
and they don't require you to. So one of our big things is that, you know, when you have stuff happening in your body, because of the nature of how diverse our nervous system is, we don't generally have a dysfunction in one little area of the body. We have different things going on, and we're going from this doctor to that psychologist to this, you know, whatever, and it becomes a very costly thing, and that is something that you know is becoming challenging for a lot of people, and because of economic uncertainty and because of the fact that things are just getting so much more expensive, and we have a lot of uncertainty in that. A lot of people feel that they are then trapped in another disempowerment model of going, but I can't go and see who I used to see. I can't afford to have the type of therapy or treatment that I feel I need, and this is really, and also this is one of the reasons why I'm doing kind of these discussions, and why, you know, I'm looking at different ways in which we can assist people in regulating the nervous system in different ways, you know, that can be more cost effective, and it can be, you know, something that is more accessible, you know. So the other thing is that a lot of people, so a lot of our more elderly population are frightened to go out and see somebody. So not only are they isolating themselves because they've been so, you know, told that they're the high risk and they almost, you know, need to take extra caution, they're isolating themselves, which is a very kind of negative model and idea in this whole concept. But the thing is that they the idea of going out and seeing a doctor or a therapist or somebody becomes another problem in that regard, and a lot of people are not doing that to stay safe. And really it is simple, and there are many things that you can do on your own, and there are a lot of things that, like I said, don't cost money. It doesn't have to, it doesn't mean you have to get in your car and drive somewhere. It doesn't mean you have to engage with another person in that respect. Like, we are engaging, and there is distance between us, but we are connecting, we are engaging. So there are ways of overcoming this, and this is the thing, is that we can look at that. And I one of the things that I do is on a Tuesday afternoon at 5, I run a meditation online. It's free. Drop in, and that's the thing, is that, so what I'm really giving there, more than a framework of understanding breathing and mindfulness and calming the mind, but I'm also providing a regulated nervous system. So that co-regulation becomes important, where we can come into a container where that is not fear-based, that is not scary and unsafe. Okay, yes, we have certain bump ups. We're sometimes coming into a space of this type of, if you're not used to this kind of online medium, it can feel a bit unsafe for us initially, but that's a learning curve. But when you can understand the value of that, so for instance, the online TRE group works really, really well, and it means that it's cost effective. You don't have to get into your car, you're not losing time, you're not you're with other people in that almost neuroceptive co-regulatory space that is healing in and of itself, that even if you do nothing, just being in the company of safe nervous systems puts us into a feeling of safety for a short period of time, and suddenly our gut enzymes will be secreted, and the body feels like it can relax a little bit, the muscle tensions, and that we haven't done anything. Okay, so that becomes quite important kind of in the way I see us needing to go forward. But as you say, we don't have to be complicated, we don't have to get into these very kind of the neurophysiology and the science and all of that is complicated, but healing naturally is not that complicated. Go and grab your book, grab a glass of water, go and sit on the grass,
Yes.
breathe and relax, watch your children play, engage with your partner, whatever the case may be. But we're too busy. We're too busy doing other things, and we're too busy making ourselves sick and killing ourselves off with all the things that we're busy with. Okay, when actually, and this is where it comes back to taking responsibility. Whereas if you really can understand the value of that half an hour in between the rat race, just go outside and sit and relax and breathe and come into a bit of presence.
So true.
All right, so we're going to love you and leave you. Hester will be doing the chat next in 2 weeks' time. So she'll be discussing the topic of female sexual dysfunction and pain. So if you are interested in that, then you can register for that one. And otherwise, we'll chat to you again whenever we see you. Good. I wish you all well, and bye-bye.